Hello, good day. This is Rey Cabazor, and thank you for joining me on this presentation. And I hope you're gonna learn something from it, and will be able to help you be self-aware and apply it in your teaching. Um, the presentation I'm going to tell you all about would be incivility in nursing education. Um, in today's presentation, we will be discussing what is incivility, the different types or forms of uncivil acts or behaviors, incivility's detrimental effects in the academic institution, its contribution to promoting incivility in nursing workplace, and how it affects student retention. What are the reasons and causes that can lead to incivility? Understanding the attributes and related theories that might foster incivility, and what we can do as nurse educators, our role, our commitment and importance toward a civil learning environment, and what we need to do in achieving our goal, and then mainly is to promote awareness and self-respect. So understanding incivility is a rude or disruptive behavior that results in disruption of teaching and learning. It is described as a violation of mutual respect during social interaction that involves an impolite or offensive act. Uncivil behaviors can cause physiological or psychological distress for those involved in the academic setting. Incivility or uncivil acts in academia can affect students. Student to student incivility can happen. The faculty in the university and all the staff. You'll also have student to faculty incivility, faculty to student acts, and faculty to faculty incivility. Um, we as nurse educators, one way or another, have probably witnessed or have been involved in an act of incivility. Still, we might not be aware that we played a role or engaged in such rude or disrespectful behavior. Um, how will you know who is actually rude or having uncivil behavior? Another person that I want to mention is Cynthia Clark. So who is Cynthia Clark? She is an award-winning professor from Boise State University School of Nursing. She is a nurse consultant for Ascend Learning, ATI Nursing Education, and the founder of Civility Matters, which she and her colleagues conducted numerous research studies that provided best practices to measure, address, and prevent uncivil behavior in the academic setting. Their studies aim to create a healthy learning and working environment for nurses, for student nurses and nurses, and she has many achievements that focus on incivility in nursing. Her work is an inspiration for nurse educators that will significantly benefit in effectively creating professional nurses that nurture civility. During her interview with Donna Nikitas, Dr. Clark shared her early years in nursing education when she entered the nursing program at 18 years old. She was exposed to being mistreated. Unfortunately, she recalled that one of her nursing professor, who seemed to kind of enjoy embarrassing her and demeaning her in front of her classmates, and worse, occasionally in front of the patients and their families. So it is easy to relate to her shared experience. Unfortunately, most nurses have the same experience or similar to the extent that we felt violated or disrespected in school in our nursing practice. Dr. Clark preferred to show incivility in a positive approach than focusing on its negative impact by putting them in a continuum. She created an illustration, which you can see in the slide, which can identify the lower forms of disruptive incivility, such as rude or dismissive comments toward this leading to the left, and in contrast to the right side of the continuum, which is the worst type of incivility, that shows a higher level threatening behavior such as acts of bullying, racial slurs, and intimidation that can quickly progress to violence. So, awareness of the incivility continuum is essential for nurse educators to identify and name any incivility acts correctly. This will help us prevent uncivil behaviors from escalating into a more severe aggressive forms of incivility, such as expression of rage and anger that can result to violence. Um, so why is incivility happening in the nursing education? Dr. Clark's publication shows that relationship when stress levels between faculty and students are high, the chances of incivility is high likely to occur. We need to acknowledge that incivility exists to be able to recognize that it's actually happening. What are the signs and symptoms of incivility? Within the incivility continuum, the negative behaviors such as rude comments, insensitive actions, unintentional slights, complaining, gossiping, cultural bias, crude jokes, and profanity are negative behaviors, while verbal aggression can be attributed to yelling, you're belittling comments to a nurse, intimidating them, putting them, giving them threats, discriminatory remarks, cursing at someone, and humiliation. While the physical sexual aggression, which is the higher level, is assault, battery, throwing objects, violent outbursts, inappropriate touching, harassment, and definitely I guess shootings in the school premises would be part of the higher level of incivility continuum. So I hope that we don't have to experience that because it can be detrimental to the culture of the school. It could ruin lives. It it has serious implication if we don't recognize that incivility is an issue in academic setting. Um, So, what are the detrimental effects of incivility? So, to the student nurse, it could cause anxiety, could cause depression, loss of sleep, feelings of being attacked, and feelings of helplessness. If you go on the other side, where the nursing faculty would have the same manifestation. So, regardless if you're a student, a nurse, a staff, once you get exposed to incivil or uncivil acts, can cause this type of things. Effects of sensibility can damage a student well-being in such a way that it could affect their professional formation. It could affect their intention to stay in the nursing program or even quit the nursing program and nursing practice altogether and just go in a different route. And then the nurses eat their young attitude, potentially carrying over to their practice. So they were treated rudely and autocratically, and they would also be manifesting the same behavior that could, like I said, carry over into the practice itself. While incivility on the faculty can affect us in a way wherein it would decreases our creativity in teaching, our quality of work, performance, morale, and productivity level. Our nursing educators or nurse educators would always have a calling, and the profession, we take it so seriously wherein we put our hearts out, we want to help them, but unfortunately it kind of hurts us when we feel that despite of the help that we're giving them, the sacrifices we're doing, is we're going to have some behaviors from the student that they'll be complaining about us. They would do some gossiping about us. So any acts of incivility could affect our productivity and creativity. So if I'm a novice nurse and I would be exposed to a rude behavior by population of students, or I might be targeted in a way, and I'm feeling a little bit kind of incompetent because I'm new to nursing and in education, it might push me to leave the academic profession. And unfortunately, that we've been seeing also nursing educators that being discouraged to stay in the academic field because of incivility. Student behaviors that are considered uncivil or acts of incivility are being late to live or Zoom classes, which are all aware. Students are not prepared for learning. It could be from not submitting their assignments or showing no interest, not paying attention, looking at their phones while they're in class or in Zoom class. You name it, we've probably seen it. a student using cell phones, texting, computer misuse during lab or Zoom classes. You're talking to them and they're just, you're not even pertaining to the PowerPoint and they're just browsing to their computer, leaving the class, online or classroom sessions early or skipping them. Or they're at work, attending class, a student cheating in other forms of academic dishonesty, which would be hard to prove, but we know we have an assumption that they have. I think I said late arrivals and leaving early. Students are sleeping in class. They're displaying a sense of entitlement. That's another thing that kind of rubs us in a different way. Aggressive, intimidating, bullying behavior. Some of our students have strong personality that we considered uncivil acts. Interruption, side conversation, and taking part in unrelated or disruptive discussion, disrespecting and challenging the credibility of the instructor or professor. They would say some comments, I don't really understand what you're saying, Mr. C, I don't get it, but they could say it in a nice way, but they'll do some rude comments. Students that would spread rumors, slurs, or sarcastic comments, or they would do eye rolling, or they'll do some gestures while you're talking to them. Um, okay, with the faculty behaviors, they are considered uncivil. Um, Behaviors that we display, that is considered uncivil towards students are, rude and degrading and demeaning actions towards students. I hope I don't play a role in this one. Sometimes I do play a joke, kind of isolate a student. But sometimes when they're so familiar, but I think I would be if I could offend them, I think that would be considered uncivil too, because I'm targeting a certain person. So me myself probably have been guilty about it. Faculty that are perceived to be making unreasonable demands, for the student, they would feel that the care plans, the physical assessments, drug cards, a lot of things that we ask of them, they perceive them to be making unreasonable demands. Faculty are not appreciating student contributions. In my culture, that's the same thing too. When students were asking me some of their, if they did well or not, usually I don't really answer it directly because in my culture, we say it when we mean it, not because we just need to. But apparently, kind of have to be sensitive about those things. Faculty are refusing to listen or openly communicate, exerting superiority or abuse of power, resistant to change, unyielding and willing to negotiate towards other faculty and students, being autocratic, rigid, and inflexible are considered uncivil acts. Eye rolling, I guess that would be a capital offense for us. When we do eye rolling, it can be perceived as a big disrespect to students, though sometimes, we're not aware of it. Ineffective teaching methods are considered uncivil to the students, being late for class. We also are on the same standards as the student. Unscheduled or announced changes to the syllabus. Those are examples that Clark and Springer had, given to us. If we go back again with the student behavior, uncivil behaviors and incivility, we use these words a lot. So number one, any rude or discourteous behavior and a display show of lack of regards to others or for others is considered uncivil. But they could also be say it could be described as an ambiguous intent, wherein a course and situation in which the person portraying the uncivil acts may not intend to offend anyone. Behaviors that may fall under this type are talking loudly, such as having phone conversation or having a short storytelling, or sharing their vacation details that can be, heard by everybody, and you could perceive it as rude and inconsiderate because you don't really want to hear someone else's story, but they don't mean that it's an ambiguous intent. Regardless of whether a student or a faculty had any intention of offending someone, it is considered uncivil because of a perceived of lack of considerations to others' feelings. So some of our student population had repeatedly verbalized feelings of being weeded out and feels like they're being judged all the time. On some occasions, students also think that they are being set up to fail. It'll be hard to convince students when they feel targeted, isolated, or judged. So we need to understand why they think and feel this way. But with that understanding, we have to recognize and be aware what incivility and uncivil acts, the students that what they're doing or what they're saying, and for us too. um so what are the reasons that can cause and lead to incivility? This issue about incivility in nursing education had been increasing. Study shows that it is continuously affecting our academic setting. It can harm faculty and students and could actually compromise student learning and effective teaching. That can be harmful to the profession. Cynthia Clark has been conducting incivility studies for the past decade to understand the issues of rude behaviors and uncivil acts in the nursing and academic and workplace setting. All her conducted studies, with help from her colleagues, they aim to have a deeper understanding in addressing it and using evidence-based measures and strategies. Um, so, so with all the information, the great deal of information that they discuss, the links with incivility is always kind of going back to the stress, or the word stress, or stress to students or faculty. Stress plays a major factor, or a major role in causing incivility in the workplace, in an academic setting, especially in academic setting, because it can be stressful when they know they're failing, because nurse educators and nurses and other health professionals work in the most stressful work environments. It is heightened, the moral and physical distress level. A student or faculty are high likely to be exposed to various stressful situations, such as dealing with the matter of life and death. Working as a nurse, you have patients that are dying or really sick. It can put you in the brink of stressful situation. Thoughts of failing from a class, well, when I was in school, I don't think I was that stressed. I know I was failing, but I think I was privileged. I don't feel that way. But our population, they can't afford to fail, so it puts a lot of stress on them. Regardless if they're doing the work, or they're studying hard. Regardless of that, just the thoughts of failing class can put a lot of stress on that person. Working a job while attending school and supporting a family that is sick, or other life essential matters and situations. You all know those stories wherein they are working students, that they are responsible to a lot of situation. And these are just some of the familiar issues we identified with our student population, and also in the nursing faculty. We have those things. See here, if you're a failure with this picture, the exams, quizzes. It was funny looking here. Oh, I forgot I had children, so I hope you all not be relating to that one. And then here, kind of a little bit comic. I love nursing school, but it caused me stress, poverty, and lack of sleep. And then the guy said, "Well, you better learn to adjust because you've only been in school for one day." And then here, relax. You always sit next to new nursing student. The good news is it's just a big figment of your imagination. And then last night before exam, see all those books, the light, we all been in that situation, and we know how stressful it is. What are the perceived faculty stressors? For nurse educators, there are perceived faculty stress that were identified. It includes problematic students, faculties, personal stressors, and inadequate coping ability, multiple work demands, heavy workload and workload inequity, advancement issues, change in faculty demographics, hiring new part-times or reducing part-times, They said that low salary are also a stressor for with the faculty, financial pressures. So both students and faculty are not immune to different type of stressor and can significantly affect the learning environment. It could be problems in the family, could be marital issues, it could be we are susceptible. We are not we're superheroes, but we are also human that can feel things. Um, so if uncivil behaviors continue to happen and tolerated, it can cause significant effect with academic in the academic setting. So there are identified consequences that are quite alarming that can happen to an individual that is exposed to uncivil behaviors. Suppose we do not address the seriousness of incivility in nursing, academia. In that case, it is expected that students will perceive unwanted or rude behaviors to be acceptable and eventually manifest in different aspects of nursing profession, mainly education and healthcare setting. So I'm going to cite some numbers that might be able to show the seriousness of incivility in our profession. It is of great need that we take Incivility Act seriously because profound implications can lead to poor quality of nursing education and patient care. So um, there is a growing need for nurse educators. That the workloads you see in these pictures, students that are hard to control, behaviors of students, and then our finances. So we mentioned that to the students and also the faculties. We also have perceived stressors that can make us do something that we might not supposed to be doing or we might regret doing or probably unconsciously. We didn't intend to do that, but it is manifesting in our behaviors. So these are the numbers. They said that a person that is exposed to act of incivility or acts of incivility, of rudeness, will spend 80% of the time just worrying about it. 80% of the time you'll be worrying about it. I don't know if you'll last for a week, for depending on how the gravity or the seriousness of the uncivil act. 48% are expected to reduce their time to work. So almost 50% productivity would be affected if exposed to it. Could be acts of bullying, being isolated, being targeted, or feeling that being threatened that if they don't make their work right, they'll fail. So that's why sometimes when we say things we have to be careful. Sometimes truth hurts, but unfortunately for them they perceive it differently. The quality of work decreases by 38%. So 48% they reduce their time to work, and then their work quality decreases by 38%. It could be schoolwork or attending classes, or they'll be there but they're not really 100% in the class. It loses their motivation to learn. And then they said effects of incivility to a person, if they've been exposed to it, they will spend 68% of their time avoiding that person that offended them. So that would be a problem if we be the instructor or the nurse educator and we were the offender. So if they pretty much avoid us 70% of the time, what would that do? It would affect retention, right? They might, started to quit. There's another slide here. So studies also reveal that if a patient or their relative is mistreated by a nurse, so for example, we produce a nurse that actually carrying burden and also doing a lot of uncivil acts or being rude to a patient or a family member. They said that a relative or a patient that is mistreated by a nurse, they would feel anxious 66% of the time when interacting with the staff that offended them. Um, so just that's something to ponder about, that acts of incivility can greatly affect a person. So in the classroom or clinical learning environment, we need to build an environment that would foster respect and civility. it's easy said than done. Civility within nursing education, they said it's really conceivable according to Nigusti and Chambers. When we each honor each other's differences and treat everyone with respect, that talks about, racial discrimination, being prejudiced, if we're being objective about things, trying to respect other people, being aware that sometimes we're being disrespectful or, prejudging people is one thing. But conversation, would needs to start. And we have to be careful and be mindful about what we say. We can't just go to a person and say, hey, you're having an uncivil act. It's because when I was reading about it, I have to read a lot and see, sometimes we said, oh, that's offending. There's more into that. But a conversation and being aware is the start. So while we value, and respect one another, we have to listen to one's opinion. And if we do disagree, to seek a common ground to resolve them. One example in community, it could be debatable. It's just my opinion, so you have to respect it. Because I mean no offense about it. So, for example, the thing about the Black Lives Matter, or or you're voting for a Democrat or a Republican, you don't have to convince anybody about it, but you just have to stay in your course, respect their opinion. If you disagree, you could probably find a way to convince them, but you don't have to judge them based on who they're going to be voting or what they believe in, because that's not the civil way if you judge them, because you don't want to be judged the same way. So we have to respect each other, and it should not change on how we treat people, on how they stand, in their political, I guess, stance. But like I said, we treat them as a person, not, we have to be objective about it. In the classroom or clinical learning environment, we must start building our students' character towards civility. And they recommend that as soon as they set foot in our class, we are instrumental. Each one of us will be instrumental to be a role model and show a respectful way of interacting with our student and peers. We need to be consistent and reinforce them throughout the nursing program, from the day of the orientation and the day the students graduate. Emphasize professionalism, respectful interactions, integrity, caring engagement, and ethical conduct that should be carried out consistently, and it's expected to all our students, including nursing faculty, administration, and staff. So everybody is accountable to our own action to behave in a civil way. So another thing that I want to point out is understanding the attributes in related cures that foster incivility. So one area that might be surprising for you all to know is in this presentation is a concept that might be new to us, or you're probably aware of it. Our nursing profession is spent most of the time interacting with people. It could be with our students, with our patients, families, our administrators, our bosses, and the list goes on and on. It could be from the very least people that we think that's unimportant. Everybody's important, and we interact with them. Several concepts and theories were studied that may be the cause of incivility. In one area that might need our attention or sound surprising to us is the model that classifies nurses as an oppressed group. They said that we are an oppressed group, okay? Because that we are prone to be subjected to a submissive, aggressive pattern, whereby we complain about the offender, but rarely confront them, you know? Similar to other oppressed groups, nurses are less likely to challenge authority. We not all of us would challenge or stand up for ourselves. Sometimes we just get quiet, because we don't want to have a target in our back, or to be construed as disrespectful. So nurses are less likely to challenge authority, especially in the academic setting or any male-controlled health agencies. So frustration and aggression and complaints can easily develop. It could boil down within a person, and are often can be directed towards other people or one another that can nurture incivility in our profession. So this behavior, such like gossiping, targeting someone, saying our disappointments and our aggression are being spent towards someone else's, and that could result to incivility. Some manifestation of this oppressed group behavior that we manifest, as nurses in our practice, is a dislike for one another. So we have to start probably liking one another, just to be aware of it. Sometimes we have a dislike, for fellow nurses. One example of this is when a preceptor or peer tried to sabotage a new or novice nurse. We have this saying, the nurses eat their young. This culture is perceived as a mild form of hazing activity, and it's actually incivil, where a new nurse is often subjected to the need to prove themselves that they possess the ability to provide care to a patient, and as a person that is reliable. In the academic setting, when we have a new nurse or a new educator or clinical instructor, we try to kind of, how will you say, to measure their ability, and we kind of prejudge them before they could actually see their potential, that they'll be an asset to to our institution. So that because of being an oppressed group, that mentality stays with us. Not probably everyone, not all of us, but I'm just saying that based on study and theory, we are being, compared to an oppressed group, nurses as an oppressed group. So at the same time, when we test the new nurse's ability, usually this should only be lasting for like a week or so. But if it doesn't improve or gradually improve the way we treat them, then it'll be a form of lateral violence or bullying, wherein it could be detrimental to the person. It's not fun, and not it's not easy to be treated that way. So why we eat our young? Like I said, to test their capabilities. We want adults, they're reliable, dependable. And well, this is how I was treated when I was, new to nursing school. This is how I was treated in school, how will you say it? So in a nursing environment or in a work, when this nurse eat their young culture persists, then it becomes integrated to their work life. Then I would say that it's also a mistreatment, or being given a silent treatment. Sometimes, when we don't like someone, we cannot, give them the silent treatment, or they talk to us, but we barely talk to them. It's like we're single them out, or, trying to isolate them from others. So being given undesirable or unreasonable assignments, like, for example, the nurse would feel like they're being given all the hard patients, the one that have Q2 pain medications, the total care patients, the older pains or blood sugars, just try to test them, or try to, I guess, sabotage them to be unsuccessful. So hopefully they'll quit because they don't belong to the group. So that is one attitude, or one part of nurses eat their young culture, that should not be tolerated. We should say something about it and stop that from happening, because it's also another form of incivility. There's an ambiguous, I don't know if it's an ambiguous intent, but that is harmful. That also, if you're doing that to a nurse, probably you'll be doing some intimidating nonverbal behavior. A lot of eye rolling or sighing, or any horizontal I guess. So, like I said, these are behaviors that should not persist, because if not, and it doesn't improve, can cause physical or psychological consequences for the nurses. Like that picture in the bottom, or the picture above it, the eye rolling. That was, I guess we do that a lot, but we should stop doing that. So how do we see the nurses eat their young culture in the academy? Like we said, it is alleged that nurse educators are the first offenders in giving too much work or assignment, judging and over testing nursing students. It is believed due to be from our previous experiences as a student from being trained and taught in an authoritarian way in nursing school. That's according to Pensionic. We can easily over exert our superiority or our position among our students or our peers. We could also unknowingly develop rigidity to change and dislike conforming to new ways by behaving to be subordinate and to follow the rules diminishes our students' ability to be creative. Um, but we expect to be assertive and self-sufficient. So we want us to for our students to be assertive and self-sufficient, but they if they try to challenge us, we kind of make that behavior to be insubordinate for us. They want us to follow with all the rules, but when we do that and tell them what they need to do, it actually there diminishes their ability to be creative and to be assertive. So this presentation does not intend to tell nurses or us nurse educators how to behave or point out the uncivil acts that we commit. We just have to be self-aware and understands how incivility affects everyone, on both sides and different people. So I'm gonna show this slide again just to refresh, that a person will spend 80% of the time worrying about, any act of incivility. 48% are expected to reduce their time to work. And then quality of work decreases by 38%, and they will spend 68% of their time avoiding that person that offended them. Um, so, as a nurse educator, we are correctly set in place to enlighten our peers and students in creating changes. Still, for that to happen, we need to understand the origins of uncivil behaviors, the behaviors that are considered uncivil, and recognize the effects of incivility in our profession, especially in the academic setting. So, being a nurse educator, just following the price for success model by Herzing, by living through what it symbolizes, can help negate the impact of incivility or any acts of disruptive behavior. So we have to employ professionalism, respect one another, students, integrity, compassion, and engagement are values that can promote civility. These values and behaviors that are expected of both faculty members and students can encourage politeness, respect, and courtesy that can enhance a positive interpersonal relationship in early learning setting. We need to be consistent and fair in implementing and lead by example by making ourselves self-aware of how our struggles and high demands in our job can easily make us frustrated or even apply our own biases and how we conduct our teaching. So we also need to assess our students to understand them better. Failure to do so can hinder us from assisting and mentoring them to be better students and eventually better future novice nurses. They might be the nurse taking care of us. So it would also be beneficial if we expose and teach our students regarding incivility and incorporated every term to increase awareness of disrespect in the nursing profession and how we can avoid them and possibly eliminate it in our practice. We can demonstrate the applicability and relevance of civil behaviors and how it can promote a healthy learning and working environment, and pointing out the negative effects of incivility by incorporating them in a classroom and clinical setting. So by providing them real life scenario situations, so for example, we're doing a simulation or a reenactment or role playing. So we could just probably have a scenario like an example on how we behave when prompted with uncivil acts. So we need to provide different scenarios and hopefully will equip us to address the situation better. So, for example, a student was really upset about the grades, and they would approach the instructor about it, questioning what's going on. Are you not giving us any points? How about this? How about that? We might have to kind of portray on how to get, how to discuss about it. You should not discuss them in public. You should set up an appointment. Should not call me out, out in the open, because incivility can incite incivility. Sometimes when a person becomes rude, we feel like we could be rude also as a reply to them. So incivility incites incivility, which could actually worsen the situation. So we could ask them how they would go about this issue. Probably have to approach you in person, be in a private conversation, and we're not supposed to address that in public. That doesn't concern everybody, even though they feel like everybody has the same thing. It should be dealt separately. Even regardless if we do this, we simulate them, it can still happen. We just have to remind them. Remember, we talked about this. We need to talk about this in a private setting, because this can be disruptive to the class. And if anybody wants to have an appointment, have the same sentiments, we have to talk about it in a civil way and what a civil person should do. So what can we do as nurse educators? Remember, I said role modeling and mentorship. Students learn by mimicking or imitating the role models, which is us or someone else's or someone they respect. Okay. When it pertains to bad role models, we said we don't like bad role models, only good ones. But unfortunately, they said bad role models may be a powerful influence too for nursing students. So even though good role models can possibly affect learning, it is also identified that bad role models may be a powerful influence on nursing students. And it is quite alarming that high quality role models lack in nursing education. That's according to Duffy. A role model or mentor should focus on addressing or supporting their student needs, unconditionally accepting them that could facilitate learning. So we need to be patient, respect them. Mentoring is focused on creating a partnership between the mentor and a student, or a novice nurse or a student. So how do we could utilize the 6 C's: care, compassion, competence, communication, courage, and commitment. But the price is the same, but we have to care. We have to show compassion. We have to show competence. We have to communicate, and we have to be courageous to face this ordeal. We have to, same as bullying or things like that. This would entrust courage, for us to elicit change. And we have to commit on it for our students, for our well-being, and to promote a civil environment. And the last 2 slides I'll be showing, and I'll be giving you a handouts with this one, is hopefully will help us like a guide or a guide for you all, after this presentation. Hopefully this will help you the way it kind of enlightened me. So be a positive role model. Okay. Be intentional in teaching civility, professionalism, and ethical practices. 3, host a formal ceremony, welcoming new students with an event symbolizing a professional rite of passage into the nursing profession. That's something that they're recommending. I think when I was in nursing school, it's I don't think it was a pinning ceremony, but I think it was accepting of the candle or whatever. There are different things that we could do as a formal ceremony. I think back then, we give them a ceremony about, they're getting their nursing bag, their stethoscope. So we could actually have that as a symbol wherein, they're having the rite of passage on that professional or the nursing profession. Those simple things can, promote a civil, productive learning environment. Take a pledge, co-create, agree upon, and implement and hold all accountable for upholding a vow of civility and norms. So it's like a civility act or probably a civility pledge that they'll, we ask them to sign the price. But this needs to be probably most on the nursing. We could kind of talk about it, discuss about it. If you have an idea, we could implement them, or you could implement them in your class. It doesn't have to be everybody or Herzing wide. You could take that initiative. Start on day one. Learning and engagement in a positive and professional environment on day one is really important. Me myself, like I said, I'm guilty about it. I want them to persevere, so I'll give them a speech wherein it kind of makes them, get culture shock. They don't know me yet. Am I already telling them, oh, nursing is hard, you should be studying now, things like that. So it's not sending a positive signal, but a negative signal for them. Then build it into the curriculum. Develop a well-built syllabi. Don't simply lecture. Move from passive teaching learning approaches to engage interactive, applied problem solving experiences, and shift from expert views to becoming a facilitator of student learning. Set the example, demonstrate civility at all times. Number nine, get creative, incorporate role play and other active learning techniques to promote empathy, communication, and conflict resolution. Then this is probably, I have to change my ways. Sing students' praises. I'm not really good at that. Reward and celebrate desired student behaviors with certificates of achievements, badges symbolizing involvement in civility related activities, and formal recognition at the faculty student events. And that's, presented by Clark, Cynthia Clark, on an evidence-based approach to integrate civility and professionalism and promote ethical standards in a school setting. So incivility is a problem is a conclusion that transpires in clinical practice, and each uncivil behavior might or might not elicit harm to our students or nurses. And if it's left unrecognized and continues to dwell in the environment, in the clinical environment, work environment, can be detrimental. So we must provide civility in the classroom and clinical setting, recognize uncivil behaviors, implement the 10 ways that will contribute to civil learning environment, have a better understanding about incivility. I got this recorded, so you'll be able to check it again. Promoting civility in the classroom can start by role modeling, discussing the importance of civility and respectful interaction in the academic setting, instilling the price of success principles from day of orientation, being consistent, fostering civility in the classroom. And that's one thing. Consistency with each one of us, the commitment, universal old rules and things that could help us, achieve civility in a classroom setting, by being in one voice, being consistent. It will be hard to achieve, but we have to try, especially by just being aware of it. So thank you for attending, my presentation. Thank you for listening, and hopefully I did able to give you, insights about incivility. And I would be attaching a survey with this presentation. Hopefully you could fill it out, and you could print it out and just send it to me by email. And I appreciate your time. And if you have any more questions for me, you could send me an email, or we could talk personally in school. And I wish you all the best. And thank you again, and see you again on my next presentation. Thank you.